I am Dr. Prashanth B N Jain, Senior Robotic Joint Replacement Surgeon at SPARSH Hospital, Sarjapur. So, as we understand, mobility is very important for health. Say it can be hypertension, diabetic, or your cardiac issues. The most main treatment every doctor writes is exercises, or walking, or mobility. So, when mobility gets compromised, all other activities slowly gets compromised. To prevent this problem happening, from Sarjapur, we are starting a new clinic called as Joint Replacement Clinic. The main concept for us of this is to treat the problem of the knee efficiently so that the knee pain should not compromise their lifestyle. Who are the people who needs? Any person who has a joint pain whose lifestyle is compromised because of this pain. So this problem should not be faced. To overcome this, we have started what is known as Joint Replacement Clinic. In this, mainly we are addressing patients who have knee pain, who are the potential candidate for knee replacement. If any chance the patient's pain can be settled by simple exercises or medication or injection, then they will be directed to dose treatment, and the patients who need replacement to increase their mobility will be guided for the replacement surgery. In joint replacement, we are coming with advanced technology, what is called robotic knee replacement. The main advantage of this technology is the precision is well planned and is perfect. So the work does not happen on the operative table, it happens on the planning table. We plan what is the size of the implant used and what is the amount of bone cut and how the implant will be placed inside. Since these are well planned surgeries, the amount of tissue handling, tissue retraction and tissue that we cut are very less. So the post-operative pain is very less, and that automatically the requirement of pain medication and its complications are very less. So these are the few advantages of this technology that we are using to make our elderly patient ambulatory. Thank you.